It's an issue we talk about all the time on the Willis Report. Sky-high medical bills. The cost of a single procedure can vary by hundreds of thousands of dollars, depending on which hospital you go to. Well, one whistleblower is filing suit against a hospital chain, saying it schemed for years to inflate patient bills. Joining me now with the very latest, Avik Roy, a senior fellow at the Manhattan Institute. Avik, it's great to have you here. I think there are a total of 8 whistleblower lawsuits. The DOJ is getting involved, and all against a company called Health Management Associates that appears to be scheming against the very patients they say they want to serve. What's going on?
Well, basically what they did was they admitted people to the emergency room for things that didn't need to be handled in the emergency room because they knew they'd get paid more by the government if they did that.
Well, we've got a couple of examples. For example, admitting a child with a fever, but the fever was only 98.7. There was no fever. Having somebody stay overnight for a scrape on their knee. This is outrageous behavior. You know, threatening, penalizing doctors who don't play by their rules, who don't try to inflate the prices. Is this just the tip of the iceberg?
It is. It's a tip. This is an incredibly widespread practice, and not just in terms of defrauding Medicare and Medicaid, though that's a big chunk of it. In general, what hospitals do is they take advantage of the complexity and opacity of our healthcare system and the way we pay for healthcare to inflate prices, to route people into more expensive services than they need, and to order a lot of services that people don't need.
It's ridiculous, and we've found so many examples of this ourselves. Recently, we had a young man on the show, Nick Gonzalez, who told his story about having to pay $50,000 for a procedure. Listen to this.
They told me that it was appendicitis, so they admitted me. They did their tests, they did CT scans, and I was out there by the next day. But a few months later, I get a bill in December, and it's a $55,000 bill. I mean, I'm 20, working in retail. I don't have that kind of money.
So he was on his parents' insurance, gets a bill for $55,000. He was on the hook for something like $12,000 personally, money he obviously does not have. And if you look at the averages for that procedure, the usual cost of an appendectomy, it's way lower. Maybe hundreds of dollars, maybe a couple of grand. Certainly not what he paid.
You know, I encourage everyone who hasn't already done so to read Steve Brill's article from a year ago in Time magazine called The Bitter Pill, where he goes through all the things that hospitals do to take advantage of poor, uninsured people and charge them in obscene amounts for things that cost pennies on the dollar. And again, this is a widespread, the most important public policy problem in healthcare that nobody talks about except you is how hospitals charge more than they need to for a lot of these services.
We've talked a lot about it on the show, and even to this day, I do not understand why they charge as much as they do. Here is what this corporate slap on the wrist quote that I wanted to read. Investors seem to think that DOJ investigations and allegations of serious Medicare fraud are simply a cost of doing business. Where is the morality in this industry?
Yeah.
Yes.
Yeah, and the only long-term solution is to put consumers in charge of their own health dollars. The reason why this stuff happens is because we don't pay those bills directly. We don't even shop for our own health coverage directly in most cases. And as a result, all we do is we care about, did I get treated when I need to be treated? And you don't look at the bill. Most people don't look at their bills.
I don't know if that goes far enough, seriously, because people don't want to compare prices. They don't know how to. They're just getting their arms around that right now.
We're far removed from a free market.
And they feel like they have no power in the system, that if the doctor says you need this and you have to pay that, that's what they're going to do.
It's a huge problem. It's a long and complex story, but we've got to address it. We've got to tackle it.
Yeah, because it's a huge part of the economy. Avik, thanks for coming on. Happy Friday. Have a great weekend.
Same to you.